We've previously discussed how the patient file has two main sections: a patient chart, which contains primarily historical information about the patient, and then the work area and the workflows, which is where you actually conduct a lot of your documentation and your day-to-day work. I'd like to now discuss some of the major regions which you would need to put on the actual screen in order to bring together the patient file into a cohesive structure. And I identify three regions here, and within each region there's some main sort of subsections. The three regions are A, identifying, B, patient chart, C, work area, and D, communication. Under region A, identifying, you'll have a patient header, which is probably going to sit at the top of the screen and display the patient name and some identifying information. And it's important that the user knows what patient they're looking at. We're going to have a patient cover, and that's going to be probably a single-page summary view that you can access within one click anywhere in the app. That's going to contain critical patient information that you often need to reference quickly. So, for instance, you might have identifying numbers that need to be written on paper requisitions often within one click away. Part two, region B, the patient chart, is where you're going to contain the actual historical record of the patient's medical information, notes, results, demographics, appointments, schedules, all that would be in there. And it probably will follow several variations of standard grouping of medical information, and clinicians will also be able to add information directly within the patient chart in the relevant part that they're accessing. So if they're looking at the allergy section, you could also update the allergies while you're there. But most data capture will happen within the work area, which takes us into region C, work area. The work area has some major subsections within it. It has a part for reminders and alerts, which is obviously going to be where kind of clinical decision support feeds in. You're going to have a part for workflows, and that's going to be the section which allows a user, based on their user type, their clinical location, and their institution, to have really customized display of the required information, the required documentation, and the necessary orders and actions, all laid out into single pages for their common workflows. There'll be a section for orders and actions, and within there you can essentially be able to place an order, such as ordering a medication, or placing an action, such as booking a follow-up appointment next week. You can also place orders and actions within the workflow section of the chart, within the relevant parts, as well as in the patient chart section of the patient file. But the orders and actions panel is kind of a one-stop screen to also perform this work. And then you'll have a checkout or a cart, which is a screen which collects all the work in progress. So this would be documentation in progress, workflows in progress, orders in progress, actions in progress, things which have been put into a temporary state before the user signs off on that. And then last we have section or region D, communication. And admittedly, I haven't fully thought through the communication region of the patient file. It's really tricky to do right, and that's kind of why I've been avoiding it. There's a potential that this section may get embedded up into region B, the patient chart, or into region C, the work area. But for now, we'll just separate out into its own dedicated area. And there's two parts of communication. There's provider-to-provider communication, regarding a patient's particular care, and then you have patient to healthcare provider communication as the other major division within there. So that's the major regions which we need to block off within this user interface, and the next post will show how some of these regions can interact with each other visually on screen.